I love this question.
I don't know. I'd like to know that too.
Maybe not the entire hospital. Why are hospitals so cold? The operating rooms actually have to be a lot colder. That has to do a lot when the body goes under anesthesia, and also it helps with the humidity and control of the microorganisms.
We run a lot of medical equipment. That medical equipment produces a lot of heat, and so it's important for us, especially in our IT rooms and in our laboratories and our surgical centers, that we have to run our temperature fairly low to keep bacteria and humidity under control.
We have to control humidity just to keep everything safe and healthy. So yes, we apologize, bring your sweaters. Do hospitals still use pagers? I'm not sure. I think more and more they don't, but they are so reliable, even more so than cell phones. So if they do, that's a good thing.
Actually, we do. Not as often as we used to, but still some of our surgeons use pagers because, believe it or not, they actually work better than cell phones.
Are all hospitals not-for-profit? Not at all. I actually come from a not-for-profit hospital, but we are part of the county hospital district in El Paso. And there are hospitals that are for-profit. You see entities such as HCA and Tenet that are some of the larger ones, but there's a variety of a mix of how hospitals are functioning and what they are categorized as.
We in Texas have generally three different kinds of hospitals. Government entities, usually built around a taxing jurisdiction. We do have not-for-profit hospitals, and we also have investor-owned hospitals.
But I assure you, nonprofit hospitals still have to make a profit to continue to invest in themselves and their people.
Why do hospitals smell weird? Well, we've taken care of sick patients, not going into too much details.
It's because we use lots and lots of cleaning products and antiseptics to keep the place clean. So it may smell funny, but it's for a good reason.
Do all hospitals have emergency rooms? Yes. To be licensed as a hospital in Texas, you have to have a fully functioning emergency room staffed 24/7.
It could be a regular emergency department as typically thought of, or it could be a dedicated emergency department in the forms of a labor and delivery unit.
Why do hospitals always serve Jell-O? A, it's cheap. No.
I like Jell-O, so I don't have a problem with that. It helps with a couple of things. The sugar helps. I think that's the nerves.
It's easily digestible and it's a good source of carbohydrates.
Why are hospitals closing? Oftentimes we have to take critical looks at what are the services that are most valuable within a community. Compensation reimbursement is something that every hospital struggles with. Our costs obviously are high. We don't typically get paid to the dollar of what the cost is. And so with that, it really poses a great challenge for hospitals.
I'm going to speak for rural hospitals because I'm a CEO of a rural hospital. Rural hospitals are closing nowadays more frequently because of where they are and the impact that insurances and payers have with those hospitals. Our payers are smaller and the amount of dollars that come through a hospital are much harder to get.
Texas actually leads the nation in hospital closures, specifically in rural areas, because they're predominantly funded through government programs like Medicare and Medicaid, which historically underfunds the actual cost of care, coupled with the high number of uninsured. And in Texas, 1 in 5 are uninsured. When you combine the uninsured, the government, such as Medicare and Medicaid, that oftentimes makes up 60 to 70% of the reimbursement in hospitals. And if they're underfunding or don't have enough insurance, ultimately a hospital is a business and they will go out of business. Why do hospitals charge so much? Doctors are expensive, nurses are expensive, drugs are expensive. If all those things are expensive, then by definition, hospitals have to charge enough to cover those high expenses.
Charges are relative to what is having to be done. For example, a lab company that does thousands and thousands of lab tests on a regular basis, they can afford to have lower charges. When you go to a hospital that doesn't do thousands and thousands of tests, their charges are higher. So you may be getting the same test done, but because of the location and because of the volume they have, those prices have to be offset to be able to maintain staff, and you have to have qualified staff to do that, and have somebody that manages all the paperwork that goes along with that lab, and then all the computer and all the summaries that need to go to the physician so patients get the most accurate information.
Hospitals are the only provider in the healthcare community that has to be open 24/7. They have to have surge capacity in case there are disasters. And then we have all of the challenges of workforce inflation because of workforce shortages. We have underpayment by government sources, so that cost has to get shifted somewhere. And then, unfortunately, Texas leads the nation in the number of uninsured. And so all of that uncompensated care gets shifted onto local property taxpayers and or the private sector.
Which state has the best hospitals? Well, I would say Texas.
Hands down, Texas.
That's an easy one. That's the state of Texas.
Texas?
Texas.
Texas, of course.
Definitely Texas.
Texas has the best hospitals in the world.